Hi everyone, this is Dr. Nisha Vishnu, consultant radiation oncologist. If you or someone you know has been advised for radiation therapy for breast cancer post surgery and is wondering what to expect, you have come to the right place. Other than the general symptoms enumerated in the first video of the side effect series, I will be sticking to specific side effects of breast cancer irradiation in this video. Radiotherapy to breast is usually offered under two circumstances. After a breast conservation surgery, that is, the surgeon has only removed the tumor, keeping the whole breast intact, or it is a mastectomy, that is, the breast has been removed completely. Radiation may be given over 1 day or 5 days or 15 days or 25 days as decided by your treating team depending upon several factors pertaining to your age, general body makeup, the tumor biology, stage, etc. etc. 1 day radiotherapy, that is, delivering radiotherapy in a single fraction on the day of surgery, is done using intraoperative radiotherapy. That is, delivering the whole dose of radiation therapy into the cavity after the breast tumor has been removed by the surgeon using a specialized intraoperative radiotherapy device. This can be done only in very selected early stage breast cancer, fulfilling all the selection criteria set by your treating team. This is a very safe procedure with minimal side effects. The healing time may be slightly more, and honestly it is quite hard to tell if the healing delay or the pain or the redness is because of the IORT or due to the surgery itself. Very rarely have we seen a major wound healing issue leading to ulcerations of the skin or long-lasting redness, and usually it all heals eventually. In a conventional radiotherapy that can either be delivered over 5 or 15 or 25 days, again a decision that is taken by your treating team after discussion with you. The skin color changes are perhaps one of the most reported side effects. This starts usually after the first or the second week of the radiation. Your skin might become reddish or even black in color in due course of time. Worry not, this is harmless, and you will get back your normal skin after 4 to 6 weeks of completion of radiotherapy. Sometimes your skin might excoriate or peel off or even exude some watery secretions, especially if you are someone with a very irregular chest after the surgery or large breast or with a lot of skin folds. Meet with your doctor to find out what is to be done to take care of it. Very, very, very rarely there could be an ulcer or a frank bleeding, for which your radiation oncologist might give you a small rest or some healing measures. Almost all these would eventually heal. Another commonly encountered side effect is a change in the consistency of the breast under the treatment. It might become hardened or thickened, and this might evolve into being a long-term situation as well. You may also appreciate some change in the contour of the treated breast in comparison to the normal one. Now, this is due to the combined effect of the surgical healing and the radiation-induced inflammation followed by post-radiation healing process. Nothing to worry, it is not harmful and will not change your quality of life for the long term. I have been told by my patients that they have these funny feelings of some, tingling or burning or some shooting pains lasting for a few seconds, on and off. Not to worry, these are again signs of inflammation and signs of healing, wherein your nerves are sending confused signals to your brain. Over a period of time, this will settle down. In some ladies, we treat the area just above and below the collarbone. In such a situation, a very commonly encountered problem is difficult or painful swallowing. Typically, it starts after the second week. Your doctor will prescribe some mild analgesics, and that should bring it down. Usually, it settles down completely post a month or so after radiotherapy. A long-term side effect found in cases of extensive surgeries under the shoulder area, that is, we call it as axilla, followed by the radiation in the same area, is what we call lymphedema, that is, swelling of the arm that is corresponding to the treatment site. This condition is more preventable and less treatable to a large extent. How to prevent? Physiotherapy exercise. Your surgeon or radiation oncologist will refer you to a physiotherapist, and if you perform the physiotherapy exercise every day, you can avoid the side effect to a large extent. Serious side effects like heart-related or lung-related issues are rare with the advanced technique that we use nowadays. However, for completion's sake, let me tell you that there is a small chance that radiotherapy to the breast or the chest wall might have increased your risk towards a cardiac event or a lung pneumonia later in the life. Again, the chances are very, very small, especially given the fact that there are multiple other factors like lifestyle and diet which plays an important part in your cardiac health. An absolutely small chance of second malignancies, that is, cancer induced by the treatment itself, has been recorded in the literature. Again, chances of second cancer due to radiotherapy is very bleak and should not be the reason to avoid this very important treatment. That sums up the side effect for breast cancers.